Have you ever wondered how doctors truly get to the bottom of what is happening inside your body, especially for conditions that do not always show obvious symptoms right away? It is a complex puzzle, and for many years, one piece of that puzzle involving liver health has often required a very specific procedure. When it comes to non-alcoholic steatohepatitis, or NASH, traditionally, a liver biopsy has been considered the gold standard for a definitive diagnosis. This invasive procedure involves taking a small tissue sample from the liver to be examined under a microscope, but exciting advancements are emerging that offer less invasive options. A biopsy has been essential because NASH is more than just fat in the liver. It involves inflammation and liver cell damage, which can lead to fibrosis or scarring and eventually cirrhosis. Only a microscopic examination of liver tissue can precisely identify the extent of this inflammation, cell damage, and scarring. Imaging tests and blood work can suggest NASH, but they cannot show the specific cellular changes or accurately stage the fibrosis with the same certainty as a tissue sample. However, the medical community is actively developing and refining non-invasive tools to assess NASH. These methods include specialized blood tests, often called biomarkers, that measure liver enzymes, protein levels, and other indicators of liver health. Advanced imaging techniques, such as magnetic resonance elastography, or MRE, and fibroscan, which uses transient elastography, can measure liver stiffness. Liver stiffness is often a reliable indicator of fibrosis and potential NASH progression. These non-invasive tests are valuable for screening, monitoring, and even sometimes diagnosing NASH in certain populations, or when combined in specific algorithms. They help doctors assess the likelihood of NASH, monitor disease progression, and identify patients who might benefit most from a biopsy. For example, a high score on a fibroscan might indicate significant fibrosis, prompting further investigation or a biopsy to confirm. The journey to diagnose non-alcoholic steatohepatitis is evolving, moving towards a future where less invasive methods can provide crucial insights. By understanding both the foundational role of the biopsy and the promising emergence of non-invasive tools, you are empowered to have more informed conversations with your healthcare provider about the best diagnostic path for your liver health, leading to earlier intervention and better outcomes.